Fetal circulation refers to the specialized circulatory system in a developing fetus that enables efficient exchange of oxygen and nutrients between the fetus and the mother via the placenta. This system is unique because the fetus does not use its lungs for oxygen exchange. Instead, oxygenated blood is delivered from the placenta. Here's a detailed explanation of fetal circulation. Key components of fetal circulation. 1. Placenta, the primary organ for gas exchange, nutrient delivery, and waste removal. 2. Umbilical cord, umbilical vein, carries oxygenated, nutrient-rich blood from the placenta to the fetus. Umbilical arteries, 2, carry deoxygenated blood and waste products from the fetus back to the placenta. Ductus venosus, a shunt that bypasses the liver, allowing most of the oxygenated blood from the umbilical vein to flow directly into the inferior vena cava. 4. Foramen ovale, an opening between the right and left atria that allows oxygenated blood to bypass the non-functional fetal lungs. 5. Ductus arteriosus, a connection between the pulmonary artery and the descending aorta, diverting blood away from the lungs to the systemic circulation. Pathway of blood flow in fetal circulation. 1. Oxygenated blood from the placenta. Blood from the placenta flows through the umbilical vein into the fetus. A small portion of this blood perfuses the liver, but most bypasses it via the ductus venosus to the inferior vena cava. 2. Blood mixing in the inferior vena cava. Oxygen-rich blood from the ductus venosus mixes with deoxygenated blood from the lower body and enters the right atrium. 3. Shunting through the foramen ovale. Most oxygenated blood is directed through the foramen ovale into the left atrium, bypassing the right ventricle and pulmonary circulation. From the left atrium, blood moves to the left ventricle and is pumped into the aorta to supply oxygen to the brain and upper body. 4. Blood in the pulmonary circulation. A small portion of blood enters the right ventricle and is pumped into the pulmonary artery. However, because the lungs are non-functional, most of this blood is diverted into the ductus arteriosus, which connects the pulmonary artery to the descending aorta. 5. Return of deoxygenated blood. From the upper body and brain returns to the heart via the superior vena cava and enters the right atrium. Deoxygenated blood flows into the right ventricle, pulmonary artery, ductus arteriosus, and finally the descending aorta, which directs it to the umbilical arteries for return to the placenta. Key features of fetal circulation. High resistance in pulmonary circulation. Due to fluid-filled lungs, pulmonary arteries have high resistance and minimal blood flows through them. Low resistance in placenta. The placenta has low vascular resistance, ensuring efficient oxygen exchange. Transition to neonatal circulation at birth. At birth, significant changes occur. 1. First breath. Lungs expand, lowering pulmonary vascular resistance and increasing blood flow to the lungs for oxygen exchange. 2. Closure of fetal shunts, foramen ovale. Closes as pressure in the left atrium exceeds that in the right atrium. Ductus arteriosus closes due to increased oxygen levels and reduced prostaglandins. Ductus venosus closes as the umbilical vein ceases to deliver blood. 3. Umbilical vessels constrict and eventually become ligaments. Clinical relevance. Disruptions in fetal circulation, such as a patent ductus arteriosus PDA or a patent foramen ovale PFO, can lead to complications postnatally. Understanding fetal circulation is crucial for managing congenital heart defects and ensuring proper neonatal care.